It's such a wonderful platform where we get to understand all the integration and all the insights we get listening to each other's talk. So nothing is different from the other. Nothing is better than the other. I think one important thing which is common sense pathy is vitamin D. Because many times people say, oh, this is allopathy, right? But of course, there are supplements which are made by pharmaceutical companies, but the fact is that it is common sense pathy because it's the foundation of everything. If this is corrected, other therapies start also working better. So I'm going to make this subject as interesting as I can in a story format. So where is my pointer? Sorry. So the moment we talk of vitamin D, we think of the divine sun and the energy we get through it, which represents vitamin D. And usually we think that that's enough and we don't need to do anything about it. But the time has changed. We are no longer in the first half of the picture. We see commonly ourselves means the general population, in the second half where there is sun phobia. And we try to cover ourselves fully. And at the same time, even though we may not be covering, the environmental pollution is so bad that we really don't get the good rays of the sun. And neither is the processing mechanism in the body that good as in the past to give us the effective format of vitamin D adequately. And now the time has come where we have to step out of the very narrow vision about vitamin D that it is just for the bones, right? The receptors for vitamin D are present in every cell of the body. And it's a nuclear receptor, my dear friends, which is found to affect more than 400 genes in the body. So you can imagine what a powerful role it must be playing. No wonder vitamin D deficiency is at the root of almost all diseases you can think of. And I don't want to enumerate them because that will unnecessarily take a lot of time. And we are standing in 2023 and we have to
I just request, one request, don't speak in this hall. Hello? Yes, Dr. Manoj, Dr. Suresh, you can go in the lobby and have discussion further.
So, yes. And another beauty of this vitamin D is that we can check it. We can measure it, right? We can just check it one test and we know where we stand. And the common levels, I'm sure you'll agree, is when you check it, it's so low. Even with the most elite doctors, it's so low that it's actually very shameful, huh? But that's a fact. And vitamin D deficiency is a pandemic much before the COVID pandemic. Thanks to the COVID pandemic, we've become aware more about the importance of vitamin D here. So what should be, I'm going to cut it really short, friends, and come to the point about autoimmune disorders. In my mind, I compartmentalize it when I see a patient. Is vitamin D for general supplementation or is it for therapy? So a quick review on general, like general masses, how much should it be? The levels of vitamin D? Well, the Endocrine Society says 30 to 100 nanogram per ml. So why are we accepting 20s and 30s and 40s in today's time? Because the functions are so varied. Even to prevent fractures, one needs at least 40 nanogram per ml, right? For a good immune system, now it is 60. To have proper balanced immune functions, 50 to 60 nanogram per ml. To prevent cancers, 60 to 80 nanogram per ml. So why are we accepting 20s and 30s in today's time and say, oh, because the lab says sufficient, right? So sufficiency range is too wide. So let's come down to at least bringing it to 50 to 60 nanogram per ml. We can check it and we have to maintain it. We have to come out. We doctors are to be blamed. We have fed it into our patients. Take a course of vitamin D. Do we take a course of food? Right? So patients will take it for 2 months, 3 months, and they say, oh, I took a course 1 year back, and I stopped it. I said, do you stop eating food? Vitamin D is cellular nutrition. And the sad part is we do not get it from food adequately. So we have to do something about it, right? So now the levels we look forward to should be checked and they should be maintained. We have to first bring it up. If we see a level of 10, which is so common, less than 4 I have seen, less than 3. These are the reports we get nowadays. So if I start taking once a month or even once a week, it's not adequate. It's like a car on reserve and you're putting half a cup of petrol in it. It's not going to work. So if the levels are very low, we have to give a, let's call it a loading dose of vitamin D, and then give it for a while, and then a maintenance dose has to be there, all right? So in today's time, 2023, we cannot become farmers. We cannot live in the 19th century. It's impossible. So we have two options. Either we take vitamin D supplement, or we fall prey to more diseases in the future. The choice is ours. And sun has come to us in a capsule because vitamin, thanks to the pharma industry here for making it. Otherwise, how would we have got it? It's not there in the food world. Definitely not in the vegetarian food world, and we are predominantly vegetarians. And even the non-vegetarian sources are not enough to meet our requirement. Our ancestors got 90% of their vitamin D sweating in the sun, and 10% was coming from the few food sources. So 90% farming for us is out of question. And where do we survive only on that 10%? And vegetarians cannot get it, right? So we have to realize that vitamin D is so vital, no longer just a nutrient, it's a pro-hormone, it's an immunomodulator, genetic modulator, and we have to take it to maintain our levels to 50 to 60 nanogram per ml. This is general purpose supplementation, right? Now let's move on to the crux of the topic today, how to deal with autoimmune disorders with vitamin D. Because autoimmunity is on a massive rise, more so after this COVID era. More so, every family has something or the other which has a little bit of that hyperactive immune system in the background. It could be a food sensitivity. It could be a food allergy. It can manifest in so many forms. It could be thyroiditis, which is so common, isn't it? So, it's very, very common. And again, we come down to the gut, right? One of the reasons why autoimmune disorders are on a rise is definitely the gut, and I will not talk much about it because we've had enough to cover except the role of vitamin D in gut health, which we take for granted. Vitamin D is very essential for gut health to maintain the tight junctions of the gut so that we do not have the hyperpermeability syndrome or the leaky gut syndrome. That's one. And two, we forget that 70% of the immune cells are present in the gut. Gut-associated lymphoid tissue, GALT. So if the vitamin D levels are good, we start working on our immune system from the gut itself. And if we do not take care of it, we are landing up into all the variety of problems. So I'll just skip, but let's know that vitamin D helps to maintain integrity of the gut. And it's very, very important. Well, this slide just shows how vitamin D plays a role in gut health. It also has a role in maintaining a healthy microbiome in the gut, which is so vital, so crucial. I'm not going to talk in details about this, sorry, because it's going to be very taxing to the mind. Would like to go more into the practical part of it, but at least let's know by this slide what a role vitamin D plays on the immune cells. I remember when I was a medical student, I used to run away from my immunology chapter. I could never understand it. I used to cram it up, just to clear off my exam. But today, after more than 35 years, I realized, wow, it's so important. And no wonder we doctors don't want to face it. Any patient of autoimmune disorder, before I knew all this, I would say, Eeks, what do I do? I'm being very honest. What do I do for this patient? They would come to me for yoga. They used to think, yoga karenge, chala jayega. But internally, I knew there is something which is much deeper. So vitamin D in so many formats works on all levels of the immune cells, whether an innate immune response or an adaptive or acquired immune response. This slide is simpler to understand, so let's get into that. Well, vitamin D is an immune modulator. It's not an immunosuppressant. So it knows which cell I need to suppress and which cell I need not suppress. So it's an intelligent molecule. No wonder it's vitamin D, divine molecule. It has some intelligence, which you can't explain, but the functions are known now. So what does it do? Yeah, okay, excellent. So it works on the macrophages, dendritic cell, blah, blah, blah. And yes, and this is the main thing I wanted to come to. When there's an adaptive immune response, we know that there are grossly 4 responses, Th1, Th2, Th17, and T regulatory cells. So let's divide them into good and bad guys, okay? Makes it easier to understand. So the Th17 and the Th1, which is more inflammatory, pro-inflammatory, and the less, or let us say the beneficial ones are, better ones are T regulatory cells and Th2 response, okay? So the vitamin D knows that किसको दबाना है, किसको आगे बढ़ाना है. Autoimmune disorders are mainly having this Th17 type of cytokines in them, and the T regulatory cells helps to develop immune tolerance, means when to stop the hyperactive response, right? That intelligence is also needed in the body. How long should I keep the immune system active? And probably one reason we are hyper-reacting to COVID vaccines is we do not have adequate vitamin D. We do not have adequate vitamin D. So the immune system is like an angry tiger now, already stimulated with the spike proteins, ready to attack. And then some flu virus comes, there's a hyper attack, and the body doesn't know where to stop. And then we get all the manifestations of an increased immune response. And vitamin D, the beautiful molecule, through the T regulatory cell enhancement, it can come to that fine balance between the immune response to have a balanced immune response. You can see how the Treg and the Th17, the one responsible for autoimmune disorders, is in action. So, cutting the story short, vitamin D has a beautiful effect on the adaptive immune response to see that there is less of Th1 activity, and it directly suppresses the Th17 reaction, which is behind the autoimmune disorders, and it facilitates the T regulatory cells to have a proper dampening of the response when needed. Okay, friends, thoda sa bolungi, but this is very important to give a insight on how it works, because we have thought vitamin D goes to the gut, gets absorbed, then it's like a hormone and it works on different cells of the body. But the beauty of this whole story is, I have to say something out here, sorry, but thoda sa technical ho jayega. So once we get, say, cholecalciferol in the liver, there is one step where it becomes 25-hydroxy-D3. Then in the kidneys, it becomes 1,25-dihydroxy-D3, which is the effective form of the molecule. Now, is this the only pathway? No. Inside the immune cells, this is very important, a very important point, that our immune cells also have the same enzyme which the kidney cells have to create the final production of vitamin D. And this is the function which vitamin D plays when it helps to treat or deal with autoimmune disorders. There is local production of vitamin D inside the immune cells, inside the macrophages. You can see it here. Vitamin D coming inside the immune cells where the enzyme is there. And finally, the vitamin D works on the nuclear receptors called as vitamin D receptor, VDR, to produce the effective happenings which we just discussed before. So this is something very fascinating. For me, it was, wow, that's the key point, right? Okay. And I would like to introduce you to my teacher in this entire science who gave me the confidence to do this work. He's Dr. Coimbra from Brazil, Sao Paulo, and I was discussing with her. Have you met him? Yeah. So I had gone to Brazil to learn from him, and why did I do all this? Because I am a patient first. I have been a patient first, myself going through tough psoriasis and various autoimmune skin disorders throughout my life, actually. So there was a phase where I was going through the problem, and I said, let me learn more. I also did functional medicine courses to understand, which opened my mind. But the most mind-blowing thing was meeting him and learning from him. He's a neurologist who used vitamin D in high doses for multiple sclerosis patients. And we'll just see. Yeah, so he was the one who started doing it. And why he did that? Why he gave high doses? He gives high doses, huh? It's not once a week. It's not once a month. The dose regimen is different. That's why I have to compartmentalize my mind when I deal with patients on that. It's found that people who have autoimmune disorders, they have genetic polymorphisms. Means the vitamin D receptors are genetically modified and more vitamin D is needed because what is produced is vitamin D resistance. Like we know of insulin resistance, thyroid resistance, there is vitamin D resistance in autoimmune disorders genetically. And such people need more vitamin D to overcome. So if somebody asks me, what is the protocol? I hate the word protocol here for psoriasis. What is the protocol for rheumatoid arthritis? It's individual. The way we decide the insulin dose individually for a patient, we have to work here also at the individual level. So Dr. he started using vitamin D in high doses because of the fact that there is vitamin D receptor resistance. And you can, I wish I had more time to show you, but just one slide, he started seeing that even the plaques in the MRI of patients started disappearing because there was myelination occurring there with the use of vitamin D. And at the same time, they're associated, this was a revelation, because he was focusing on myelination with vitamin D, which we all have studied in MBBS or during our medical school days, right? He saw that their other autoimmune conditions also started improving. They had associated problems, and they saw, oh wow, the psoriasis becomes less, it's disappearing. What did I do? I was targeting multiple sclerosis. So now that work has expanded, and he trains people, and it's being used for all autoimmune disorders because the focus is not the manifestation. The focus is internal, the cause, like we've been discussing, how to deal with the right one. And this is a wonderful paper that has come in 2022. It's a very, very recent one. Those who are interested, you must see this one. How vitamin D resistance and all the mechanisms are given a need for using high doses of vitamin D when we have to treat it. You must read this paper. And there are enough evidences that vitamin D resistance is responsible for not just multiple sclerosis, you can see for lupus, for Graves' disease, Hashimoto's, type 1 diabetes. For psoriasis, there are different vitamin D polymorphisms, means we need to give more vitamin D. For rheumatoid arthritis, vitamin D receptor polymorphism in RA. So basically it is cellular. So now this vitamin D resistance, receptor problems, this is the base of it. Then there are some environmental factors, and then there are some exacerbating factors to enhance this vitamin D resistance. So apart from giving more vitamin D, we also work on strategies how to improve the vitamin D receptor sensitivity, right? And there comes the role of so many cofactors which are used, like magnesium, zinc, omega-3 fatty acids, so many things in the therapy. So now friends, make it very simple. The reason of autoimmune disorders, when it comes to vitamin D, there are so many, but one very important common sense pathy factor is either vitamin D deficiency, and if patients come who have good levels of vitamin D, we still give them vitamin D. That is the point. So first we have to fill up the petrol in a vehicle on reserve, but still we have to continue giving more petrol to basically deal with the vitamin D resistance they have. So there are two mechanisms. So well, this is just a picture of those golden days when I was there to learn this, which has revolutionized my medical practice. I feel I wasted 25 years not knowing about it. I could have done much more to so many patients before that. Because even today, medical schools do not teach that role of vitamin D. I've been checking with MBBS students, kya padhate hain about vitamin D. Anyways, so now what is this famous Coimbra protocol? One, vitamin D is, sorry, something went wrong? Okay. So vitamin D has immune regulatory role, we saw that. And there is vitamin D resistance, so we have to look at it. How? To compensate for the resistance, higher levels of vitamin D needed. And point number 2, it has to be taken more frequently. The half-life of vitamin D inside the immune cells is 24 hours, while the half-life of vitamin D in blood is 15 days. So we have the answer. And we want the action where? In the blood? No, we want it inside the immune cells. So in this protocol, vitamin D, clap for that. And the intelligence of the divine to make it. Yeah. So vitamin D is needed on a daily basis. For that reason, thanks to science for proving it. Now friends, a question comes, toxicity. We doctors already have a big phobia of vitamin D, which has been fed into our minds. There is no vitamin D toxicity the way we think it is. Anyways, so how do we deal with it? How do we know how much is the vitamin D resistance in a person, how to give, how much to give? So only vitamin D levels is misguiding. It has to be accompanied with what? PTH. Very important. Parathyroid hormone levels, because vitamin D and PTH have a seesaw type of relationship. So when vitamin D is either low or it is, you know what you call it, vitamin D resistance, means levels are good, but there is no effect of vitamin D. That is vitamin D resistance. So when the effect is not there, PTH is expected to be up, because it's a seesaw relationship. These are all biological mechanisms, because what does PTH do? It pulls the calcium out from the bones, because the blood levels of calcium have to be maintained for certain functions. Vitamin D not there or less, calcium is not getting absorbed, but blood levels will be maintained because PTH says, don't worry, I'm there. But who's getting weaker? Our bones, okay? So the moment we give vitamin D, or we take the levels and activity up, the PTH comes down. So if the PTH is coming down, means vitamin D is working. And that's how we monitor the therapy. How much time do I have, Millie?
2 minutes over.
Oh, don't tell me. 2 minutes overtime ho gaya? Oh God. Okay. So see the common reports, low vitamin D, high PTH. I have to really rush. And I have to show you my own report right now. When I was going through my problem, see, my vitamin D here is 138. Okay? I was given a call. How are you, doctor? Are you fine? I said, don't worry, tell me my PTH. It was within the range. So it means I'm fine. And that is how we monitor and assess the protocol. Okay, friends? So PTH level monitoring is important. And this is a slide from the same paper, actually, which talks about the doses which Dr. Coimbra has finally sort of made a little line. Multiple sclerosis patients need more vitamin D than any other autoimmune disorder. So 1,000 international units per kg per day. Can you believe it? 1,000 IUs per kg per day. All right? For other common autoimmune disorders which we see, like rheumatoid, psoriasis, excellent, 300 to 500 IUs per kg per day. Yeah? And in general purpose, he says you can use the formula of 150, general health, 150 to 200 IUs per kg per day to decide the doses, right? So let me go ahead faster. So the fear now comes is toxicity, which is not because of vitamin D, it is because of hypercalcemia. This is what we have to prevent. So on the protocol, we stop calcium supplements. We monitor the diet, what are they taking here, not to let hypercalcemia occur. And we do a blood test, simple, it's a trio, vitamin D, Kia, PTH, and then is ionized calcium. Serum calcium is misguiding. So we check the available, bioavailable calcium, that is ionized calcium, and don't let it go above the limit. So whatsoever the level of vitamin D may be, if the calcium is in the range, we do not expect, toxicity to occur. Okay, a lovely paper by Dr. Michael Hollick from Mayo Clinic which says that there is enough evidence toxicity nahi hota hai till a person is taking high doses for months to a year, and that too without monitoring for hypercalcemia. So we have to have an alert. And by the way, magnesium helps to prevent hypercalcemia. So we use all this in the protocol, very important. Magnesium, K27, good hydration, and limit the dietary calcium intake. So toxicity is not to be feared of, and all these form a part of the protocol. Just quickly showing you now some cases if you want to see. Oh, well, that's me only when I had a part of my problem starting out on my feet, hands, arms, everywhere. And moving ahead, that was me when I had lichen planus pigmentosa on my entire face, on my entire neck. I could not face my patients. They would say, "Aap to pranayam sikhate ho, how come you got it?" Yeah, I had to face all that. You are running a yoga center and you got this? So then I realized that for a software to work, the hardware has to be corrected. Pranayam, yoga is a software. Yeah, we have to correct our deficiencies which are not happening otherwise. So well, now I'm standing in front of you. Thanks to vitamin D. And the passion it gets with that I'm, lot of opposition from my doctor colleagues. I'm on their gunpoint. Really, I can't tell you, but the stamina comes when we see the patients responding. Huh? So these are my patients. You can see some of them. Well, before, after. Gentleman from Canada. You can see how bad a problem he had, and he's doing very well now. This gentleman, I've never met these people. It's all online because I do online work as well. You can see how bad a psoriasis, 22 years old one, just 4 months of treatment, and he's maintaining it now for almost more than 1 year. You can see how good it is now. This is a child with atopic. You can see, oh, sorry. Anyways, you can see so many things before, after, and well, thankfully, could publish a paper, right, in which I shared 6 cases of psoriasis, just 6 cases, thanks to Dr. Pradeep. It was his motivation, his support that likhna pada, you know, and we are still working and we have lots to share, you know. Yeah, absolutely. So I just discussed 6 cases in this and the doses used. Well, now you're going to get the shock of your life. Hold on. Yeah. So we used 30,000 IUs to 60,000 IUs daily. Daily. And I'm standing in front of you. To overcome my problem, I have gone up to 50,000 IUs daily. And even today, I take 20,000 daily to maintain it. The point of the pudding is to eat it. Eat it, yeah. So that's why I did fugri yesterday. You saw that? Well, so 20,000 because it keeps my things in order, and my other health parameters have also improved because obviously it is working on every aspect of it, all right? So time is short. These were the 6 cases you can see before, after, and what I want to share with you, if you allow me, Millie, I'm over time here. 5 minutes? 5 minutes. Can you tolerate me? Oh, really? Wow. No, I won't. So just to show you how monitoring is done.
What the hotel people, are they here? Hotel का है ना? आप खाना चालू कर सकते हैं, आवाज मत करना please, don't. And you please continue, I'm so sorry. 5 minutes.
Just to show how we do the monitoring, because there's the questions I answer every, yeah. So now this lady, starting level of vitamin, this is how I maintain the records of all patients. Have developed a software for it now. So vitamin D levels on the start. By the way, levels, nanogram per ml versus nanomoles. Yesterday only somebody said, my vitamin D is 130. I said, how, nanomole or nanogram? So if it is nanomole, please divide it by 2.5 to come to nanograms, which is the unit of communication. Don't just get carried away with... A few labs do nanomole, like the very popular and good lab, Dr. Lal's Path Lab. They do nanomoles. Yeah. Yeah, Metropolis is nanogram. If it is nanomole, you divide it by 2.5 to get it into nanograms per ml. We'll come to that later.
Do training, Dr. Bali.
No, even with sunshine, you're not sure. Please check it. let's not be overconfident because we are in a tropical country, we see the deficiency. We've done a survey in tribal women just 2 months back, went to Sangamner, have adopted few villages where I'm distributing vitamin D to the people. That's another paper coming up with Pradeep. And you won't believe even tribal women who are working in the farms, we found vitamin D deficiency in 95% of them. Yeah, absolutely. So we are nothing in front of them. All right, friends, so you can see the starting level. PTH is 15 to 65, the range of it. Ionized calcium should not be above 1.33 to make the story short. So how much we started her on? 30K daily. Follow-up, third follow-up means after 4 months roughly, her psoriasis was 80% less. How much was the PTH? It had dropped from 37 to 21. Calcium was maintained. Because she was doing well, reduced her vitamin D dose from 30K to 20K daily. So the target is not to bring the PTH to 15. It's just a guide. Clinical presentation is unmatched. And based on that, we decide, okay? So anyways, now she's doing pretty good, and we've brought her to 60K weekly, the common dose. But initially, she needed the high kick to see that the autoimmune process is on, and one need not continue that dose lifelong. This I've realized. So why to give extra? So now we try to bring them down to the maintenance doses. Here out, I'm not worried about the before after. I want to show you the chart of her levels. So when she came, you can see it was 11. A lady with psoriasis for years, and nobody checks it obviously. 11 is shameful. PTH was on the upper limit. 65 means vitamin D kisi kaam ka nahi chal raha hai. This was another lab. She's from Dubai actually, so the unit was different. But still it was, you can see it was below the normal range. So now, should I start her on 30K? No. She needed the petrol. So I gave her 1 6 lakh unit dose, the one we have in India, that ampule. Yeah. And I give it orally. I use. Thod ke pee jao. It works equally like injectable. You don't have to give it IM. So just one ampule, and we use it a lot in COVID time when patients were in the hospital, giving them one ampule through the food, through the Riles tube, and we got some amazing results with that. Okay, so gave her this 6 lakh once, and then 30K daily. Follow-up, PTH had come down, you can see from 65 to, so we have to monitor all that. Ionized calcium, now she was in India for a visit, so the unit is different, but within the range. So vitamin D dose slightly reduced. All said and done, you can see how the things have progressed. PTH coming down from 65 to almost 13, 18. Calcium maintained all through. And the vitamin D dose, now she's taking 20K daily. Timing, it depends. Every patient, I can go into details. For me, every 2 months is a pattern, but there are some patients, we meet them once every month in the beginning. But the testing we do after 2 months, unless somebody has very high calcium at the start, so we have to check it in a month's time. So it depends, depends upon the patient. Oh yes, this lady, it's a story. Rajkot, her whole body, she had literally, you can say, oozing, weeping skin autoimmune problem, and you can see how she's now. You have to see her smiling. She's 100% off the problem, which was there with her for years. And this lady on the start had a vitamin D level of 9.44, PTH high, whatever, gave her same pattern like that lady. You might be wondering why we start 30K. There's a paper published by Dr. Coimbra's team that 30K per day for 6 months is an average requirement, but it varies from person to person. This is what I want to show you here. So anyways, we started, and after 4 months, second visit means roughly 2 months, PTH had come down, but her psoriasis, there was no improvement. So I increased it to 45K daily. I gave her a jump. She's safe, her PTH is still not completely suppressed. Then on the 4th visit, you can say PTH has still come down, but still not touching the lowest, but there was improvement showing up. So she needed me to, take it up to even 45K, and now she's maintaining, abhi to aur acha ho gaya, she's taking 60K once a week and doing pretty good. 99% better. And in case they get a relapse or something comes up, we can always give more vitamin D. So the confidence comes in. I tell my patients, you are on the driver's seat. I'm by your side. I want to train you so that you don't have to come to me whole life, right? If tomorrow some trigger happens and you get a problem, how much to increase? It's individual. Huh? Thoda sa badha do, take it for a couple of months and then come back. So one knows how to steer the car of their own problem. This is a doctor and he responded very well. You can see his whole body had the problem. Before, after, and his vitamin D levels on start were good, 61, but he was suffering. PTH was 24, not bad, but he had to be given vitamin D, okay? So we started him on 30K, and he's a doctor, so he would check his vitamin D level also. In our follow-up checkups, we normally don't advise to check vitamin D, because number one, it's expensive, and it is going to go up. And we take the consent form in which we have already made them know that your levels will go 150 or maybe above. Please note. Without that, stop calcium. It's a huge consent form now. It's increasing day by day because I'm learning with experience what more to add in it, you know. We have to be very careful.
First, save ourselves.
Absolutely. So anyways, look here. So his next time he came, his was, 160, was worried. And his PTH also dropped down, you can see. But he had a response also, thankfully, 70 to 80%. But I didn't stop the vitamin D. He still needs it. I've realized 6 months, you need to take it monitored. And then based on individual response, you can sort of work it out. So I said, no, we can't stop it. We'll give it to you. He agreed, 20K with permission. I explained I have to do a lot of talking with them. And then, because there was improvement, he was very happy, 70 to 80% well. Okay, next time when he came, see how the vitamin D levels have come down, but they're still more than 100. PTH is fine. Then we further reduce it because there was improvement. And now he's on that, 20K, doing very good. His levels are above 150. He's not bothered. PTH is good. Calcium maintained. And he's doing very good. All right, so this is how the things go. Don't think it's only for psoriasis. Huh? It's easy to show pictures. We've had some RA reports also getting converted from, you can see RA positive values coming down. And there's some patients unka RA nahi badalta. RA remains high, but clinically they are good. I'm sure you'll agree that seronegative rheumatoid arthritis is more vicious than seropositive. So we don't have an explanation for everything based on lab reports. I tell them lab reports are to guide, but they are not the decisive factor. But their guidance is important. Yes. So why not take it? Yeah, we are lucky to have them. This is a patient with myasthenia gravis who was on a lot of medicines, immunosuppressants, steroids, azathioprine, sab chal raha tha. Now, the duration needed of treatment was more for her, but finally we've been able to bring her off all these things that she was taking. And she's in remission for more than 2 years. She had a ptosis. I didn't keep the picture because she didn't want me to show it. She's a scientist, and she had a ptosis, and now the ptosis has completely gone, and she's doing very well. So we had a control on her myasthenia symptoms as well. Multiple sclerosis, this young girl, I missed the slide. Okay, so she was the one with 15. Sad to see MS patients coming with these vitamin D reports. We doctors can at least give them vitamin D because we've studied myelination hota hai. So levels kam se kam 40-50 to bana de unka. But we see these reports and you can see blah, blah, blah given to, we had to take her up to 60K per day. She had a lot of symptoms, and now she is completely free of symptoms to that level that she became pregnant. After coming in remission, she is having a child, and she says, Auntie, please show my photo to everyone. She's like my daughter. Yeah. And she's doing very well, no symptoms at all, and her maintenance dose is 30K daily going on. Oh, this is another great story I want to share. Doctor, I'll not take the name, with multiple sclerosis, and starting level was 92 already. PTH 32. It was not less than 15. Calcium low. Started him slowly, took him up. His levels at a stage even went to more than 200. But he was adamant. He was doing his MD medicine that time. We had to take him, he responded after a while, 40, 50, 40, whatever. I wish I had time to go into details. But the good part of the story is his lesions have disappeared in the MRI. Yeah, you can see here, as compared to previous MRI, no, you don't, where is it? Are not seen suggestive of resolution. And the best part of the story is, he has taken DM neurology. Yeah. And he says that because I have seen the benefit, now once I become a neurologist, I'll be able to help so many MS patients. And even now, my hairs stand up when I say this. Because it is, I think, a big thing to happen, making a neurologist who has benefited with this treatment. Thank you, friends. Yeah. So we had a patient with psoriasis. And incidentally, his TSH was very low. He had a trait of toxic thyroid symptoms. We didn't treat, we said, dekhte hai. And just with this treatment, his TSH levels came up without giving any neomercazole or anything else like that. A young child with autoimmune hemolytic anemia, skin problems improved, and the liver enzymes, you can see, they were 2017-84, the liver enzymes of the child have normalized. So the message here is, it's working everywhere. And liver detox, when we correct the vitamin D levels, we enhance our detoxifying mechanisms in the body. Chelation, it supports the chelation therapy. It enhances the natural pathways of detoxification that we have. A young, a middle-aged person, you can see the darkness improving. I'm just skipping all this. The more the number of autoimmune disorders, more vitamin D is required. Yeah, so this lady had not just psoriasis, lupus, Sjogren's, and Hashimoto's. All together, you can see how bad the skin was. Took a long time, and now look at the legs that she has. These were her joints, the look of the hands, all inflamed. So finally, observation, nothing is 100%. Don't think that everybody responds like this. There are a lot of challenges, and there are so many people who are partial responders, no responders, so we are working on that, what else can be done, maybe that we can add in our later things. But definitely, permanent remission, and I'm being very conjuice here, it's 50%, maybe sometimes more, it depends on the disease. We get permanent remission, and even if it is 30%, isn't it amazing to give remission to 1/3 of your patients? And this is very sparingly, I'm telling you. So we get permanent remission provided, there's a conditions apply, provided they keep taking the appropriate person-specific dose. So it continues. We don't stop it. The way we don't stop eating food, we cannot stop this cellular food. Remaining get partial relief, which is significant. Even that improves the quality of life. We see partial remission. And those who do not get, let us say, some faida, they still have a benefit because the progression can be controlled and you can prevent the recurrence and the happening of other autoimmune disorders, which there is a tendency for them to happen. Okay, friends? So another great paper, if you want to read, a new one done, 2022, safety data, where they have seen many patients who were on this high-dose vitamin D protocol, and they have found that side effects and all. If you want to read, you can please go that. So there is no fixed dose for any disease. It is individualized, it is customized based on all these parameters. And if not, treat with high dose. We do take training programs, by the way, So please don't just think that I will start giving. You have to really, you have to understand the, and today I can speak with confidence because I have gone through a phase where I was scared in doing it. Really, it was tough to get into this mode, but with time, you get the feedback and the confidence comes in. So at least one thing we can do, that we see that our patients are checked vitamin D wise, given adequate vitamin D to have levels of at least 50, 60. And as I said, you can go even up to 100. There is no problem. And we try to at least maintain it. Okay? So these are various charts on doses, blah, blah, blah. I have to skip it. And the message, you want it? All right. But don't take it like a God's norm. Yahi dena hai. You have to understand and do it. These are for general purpose dosaging, right? This is just a sliding scale. I found it very interesting that just see that if somebody has a vitamin D level of say 10, and we commonly doctors think 2000 IUs per day de diya, it's good job we are doing. So how much will it take the level up to? Only 20. We cannot be happy with that. So this is like a sliding scale. I find this very interesting. Starting levels of vitamin D, how much you are giving, so roughly how much will the levels go up. Because the levels going up or whatever is also dependent upon, if somebody is obese, the vitamin D requirement is 2 to 3 times. It cannot be the same because vitamin D gets sequestered, you know. Sorry. So it's not an optional supplement, it's a necessity in today's time and beyond. And my just prayer for everyone that this light of sun shines in everybody's life and health in the form of vitamin D. Because we are not harming anybody. We are not doing any harm as per. Thank you so much.
Thank you, Dr. Renu. That was really amazing. Thank you very much. So please accept this small token, sir, please. Dr. Emilia? Yes? Hello? Yeah, you're the official deliver.
Thank you.
Okay, so... Sir, come.